Hi, welcome back to Rohrich Knows, helping you become a better you. I'm Dr. Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Today, let's talk about a real hot topic, buccal fat removal or not. When should you remove it, and what is the best indication for buccal fat removal in aesthetic surgery? It's really become a social media mania on buccal fat removal. I see so many patients that want their buccal fat removed, and most of them don't need it. So let me share with you what I think is an ideal patient to do it and then to not do it on. So, buccal fat is really the fat that's in the anterior part of the cheek right here, and it's above the mandibular border, as you can see here, and it's really one of the many things that helps to shape the jawline. It's the front of the jawline. In the front, it's the buccal fat. Behind here, it's the masseter, and below, it's the jowl and the neck. So the buccal fat is very, very specific. So this, I think, is a classic, great example of somebody that needs buccal fat excision because he's got fullness in the anterior cheek, not hollowing in this area, and he's got a full face. So the key is it's got fullness anteriorly, and this can be done in the operating room or in the office. I prefer to do it in the operating room. And the key is less is more. Don't take out too much, and I'll show you the anatomy of it in a little bit. But this is exactly the area you want to take it out. So I'm going to go down the path of how I do it in a safe and effective manner. And this is actually also published in our journal, Plastic and Reconstructive Surgery, the 5 Ds for safe and effective removal. And you identify Stenson's duct, you dissect it out through the buccinator, you deliver the fat, you debulk it gently, and then you do a final assessment, a denouement. And I think those are the 5 key things to do it. And this is just a very brief video to show how you can resect it and gently tease out the buccal fat. This is done with electrocautery, and you're really doing this intraorally. There you can see Stenson's duct above you, and you can really just shape it out. Remember, tease it out gently. Make sure you have meticulous hemostasis so it can be done. So you can do it very atraumatically. And then here's a patient that shows it early post-op. You can see the hollowing gently. And here's the amount of buccal fat that's taken out in these types of patients. And then here's a patient that just shows it intraoperatively. You can see the hollowing and the concavity in these patients. So, and this is a typical amount of buccal fat that's removed. And one side will always be a little bit more than the other, and you can assess that preoperatively. But let's go and understand the anatomy. There are 4 lobes, so you don't just take out the buccal fat. There are buccal fat. The buccal fat is a very unique type of fat compartment. It glides in the superficial and deep fat compartment. There's a buccal fat one, and then there's a medial and lateral pterygoid compartment of fat, and there's even one that goes to the temporal area. So there's 4 different types of lobes, but you're only removing the buccal fat one. And that's done very meticulously. And I can't overemphasize the importance of doing this without tugging and taking out more than you need. And it's very important. That's why I like to do it under general. And I can see the concavity in this area. So it's very important. So you can see in this patient, the buccal fat has been removed. The fullness is now softened. And you have a slight concavity in the inferior lateral jawline. And it really gives them a nice, gentle look. Now, and again, if you don't have that fullness and you take out buccal fat, it will age you, because this is the only time when you can take out some buccal fat without aging the patient if you do it in the proper patient. Most patients, they present like the patient on the right afterwards, and if you take buccal fat out in a patient that's already got concavity, then you'll make them look older and age faster. So I can't overemphasize how important that is. So know before you go, the most important thing is understanding how people age, when to do it, and how to do it safely. And those are really the 3 cardinal rules that you should go take, maybe the take-home message here. So you need to have lower cheek fullness and a full face, and less is more when taking it out. That's the cardinal rules, so know before you go. And I can't overemphasize the importance of buccal fat, when to do it, when not to do it, and how to understand the anatomy so you do it safely. So know before you go. So I hope this helps you understand not only when buccal fat should be removed, but also when it shouldn't be removed, and then how to do it safely and obviously to get the result that you want. So know before you go, and make sure you comment below on what you think is good about buccal fat. And I always look at what are the short and, more importantly, the long-term consequences of any surgical procedure we do. So know before you go, and until next time, stay safe.